Greetings, this is the coronavirus COVID-19 update for 3/8/2020. And as usual, we will start with the Baidu numbers. Baidu is a Chinese search engine, and they have set up a site to track the Chinese figures for this site and news related to that. The most significant number here is a cumulative diagnosis on the bottom left, 80,904, up only 45 from yesterday. These numbers are getting really small in China because China is, after messing up and infecting the rest of the world, they're starting to do things right. Number of suspected cases, 421, up 60 from yesterday. Cumulative cures, which most people call recoveries because China did not cure 58,000 people. They recovered most of them. Existing severe, these would be ICU cases, intensive care unit, respirator people, people with organ failures, mostly old people. And cumulative deaths in China, 3,123, up 23 from yesterday. And if you scroll down on this site, there's a lot of other information. Then if you scroll down further on the same page, you see a map of China showing the regions. And this is starting to change, and the reason it's changing has to be due to, there's no explanation, but it has to be due to the fact that they're taking the total number of cases and subtracting the number of cured cases. Then if you scroll down further, you see the first graph. This plots deaths, recovered cases, suspected cases, and diagnosed cases. So we have new deaths 23, additional recoveries 1,541, and new diagnosis 45, and suspected 60. Then further down you see a graph comparing gold, which is non-Hubei province, which is on a downward trend. And then the pink line is Hubei province, and then the red line is all of China. So the Hubei is still the epicenter where Wuhan is located, and the numbers there are so significant that it affects. It's almost the same as the national graph because there's not much going on outside of Hubei province. They don't have all these numbers updated, but Hubei province has 36 new cases here. This is a list of provinces, and you can open these up, and I opened them up, and the numbers under Hubei are not updated. So there's not much to show you here. And there's usually an explanation from the Chinese guy that's doing this, and it says, please forgive me if the data lags. And then they threw in a new map, which is a global picture, but it's not as good as the Johns Hopkins one, so we'll take a look at Johns Hopkins later. Then we have, as you scroll down the same site, we have the hot search topics of the day. And these search topics, sometimes they don't make sense because they're Chinese people looking for a story. So this thing uses logic to, assign stories to the search topics. So we have 7 for today. I don't usually take a look at all of the stories, but some of these are pretty pertinent, so we'll take a look at them. So the first story is in Nanjing, and this is apparently Nanjing had their scheduled grave sweeping ceremony, which is the time of the year where everybody goes to visit their family, their dead members of their family, and honor them and make little crazy sacrifices at their graves of paper cell phones and paper money and stuff like that. Nanjing is a former capital of China, and also where the Nanjing massacre happened, the rape of Nanjing. So there's a big, huge monument there dedicated to the people who died in World War II at the hands of the Japanese, the massacre. Health Commission, 2/3 of Hubei or a medical aide to Hubei is female. That's no surprise. Nurses usually make up the bulk of the staff. That made the news today. And yesterday, what made the news was a story about Women's Day, International Women's Day. And I added this photo from yesterday on the bottom right because these are what these frontline Chinese nurses look like after their 12-hour mandatory shifts with no breaks. If you want to stay alive, you wear your mask pretty tight. If you wear your mask pretty tight all day for 12 hours, this is what your face looks like. So you got to hand it to these ladies. There should be some kind of monument made to the nurses of Wuhan and Hubei province. Sometime after this is all done. A lot of frontline medical people have died. 1,700 was quoted a couple weeks ago, and now the latest number I hear is 3,000 frontline medical people. Not died, I'm sorry, infected. Then what do we have on the left? This is about the hotel collapse. They investigated the people from this hotel. China had a collapsed hotel, and the hotel was used for a quarantine for COVID-19 cases. And this report said that 58 people there that were staying in that hotel were negative from a nucleic acid test, one of many tests that they can use, to test for coronavirus. The United States isn't using any tests because we don't have any tests, because we have this organization called the CDC that we'll talk about later. So anyways, 58 people were staying there that shouldn't have been there, I guess. Then the National Health Commission responded to the Hygiene subsidy. This is just a story. It's really hard to translate, but I finally got something that made sense. They're looking into, I guess, a little bit of corruption here, where the National Health Commission found that some subsidies to medical people on the front line were out of line. A little bit, in other words, somebody's handing money to somebody. And then on the bottom right, the State Administration of Radio, Film, and Television, they're starting a TV series about the coronavirus. And, it's kind of, you can look at it as propaganda, but you can look at it as, maybe this is a decent TV series that people would actually watch, and, they'll show people how to not get the coronavirus and other things. Then what do we have? There's a study on this hotel that was collapsed. It was built less than a couple years ago, and it met code at the time. But one thing that it never has met is the capacity. So it's hard to believe. I just can't picture too many. I stay mostly at Marriott hotels. I just can't picture a Marriott hotel collapsing because there's too many people. That's just crazy, but that's what happened here. Anyways, they say that it was built 2 years ago, and it has been cited that there were too many people in the hotel. Still, hotels shouldn't collapse. And then there's a story on the right where Italy blocked cities such as Milan and Venice, and that made the Chinese news, but we'll take a look at it later in the Western news. Then we take a look at the Johns Hopkins Global Tracker, and the location of this is in the description below. Globally, we're at 109,840 cases now, and total deaths 3,803, 60,704 recovered. So the first thing that we do with this is take a look at the Chinese numbers. The cumulative diagnosis from today was 80,904. We have it at 80,700 about, so we're behind a couple hundred, so that means we're at a total of 110,000 global now cases. And then I take a look at the hotspots, and this is really alarming. What happened in Italy? Italy was number two. Italy was number 2 behind South Korea and then Iran. These are the 3 global hotspots that are way above what everybody else has. So South Korea increased from 70.41 to 73.13. Pretty mild increase compared to what's been happening. It was several hundred every day. Italy went from 5,800 to 7,300, and now they're number one outside of China as far as the number of cases. And Iran went from 5,800 to 6,500. So if you look at the right, Italy now accounts for 366 deaths, and Iran 194, and South Korea 50. And then you'll see the next thing down is Henan province, which is the second most populated province in China, behind Guangdong province down south. And the reason that they have so many deaths is because it's a big province, But on top, Hubei province, 2986, leads the world. But now you have Italy, Iran, and South Korea creeping up there. They're the second most number of deaths in the world outside of Hubei province. So that's really alarming what's happening here. So we'll take a look at Italy first. What do we have about Italy? Italy implements sweeping COVID-19 quarantine, affecting a quarter of its population. So due to this big number of deaths yesterday, in Sunday Italian time, they came out and announced that a lot of other cities are going to be locked down now. So it says Italy took a page from China's playbook, locking down around 16 million people, more than a quarter of its population. Weddings, museums, movie theaters, shopping malls, even restaurants are hit by the new restrictions. So this is like a swath of northern Italy. It includes, lists some cities here. Modena is, if you're a Ferrari fan, you probably recognize that city. A bunch of other cities, but, Milan is the big one. And then on the right, Italy's government placed more than 16 million people, the same news. This is Lombardy region, including the city of Milan, Venice, Parma, and Modena. And also on the lower left, we have a cruise ship in Malaysia and Thailand. The cruise ship industry is going to be hit even harder than the airline industry. And that's unfortunate, but they have to be hit because we got to keep people from traveling, infected people, or people suspected of being infected. So here we have a cruise ship that was bound for Malaysia and Thailand, and it had a number of Italian people on it, and they wouldn't allow the cruise ship to come into Malaysia or Thailand. This is South Korea, and like I said, the numbers are way down compared to what's been happening there. And middle story, Korea Herald, Prime Minister casts cautious optimism about the containment of a new coronavirus. On the upper right, mayor and virus hit South Korean city. This is where that church outbreak was, this crazy church sect, that has 1,000 churches in South Korea and 450,000 members. So that's where all this stuff started. And, the mayor of that city says the outbreak may be slowing. And then on the lower left, the United States Army announced that they're suspending travel for soldiers, families to and from South Korea. So that's basically a lockdown on the U.S. military base there, which isn't far from where the church was, where the first outbreak started. U.S. military base is not far away, and there was a soldier infected almost right away because he was visiting Daegu, that city in the southeastern part of South Korea. And the last I heard, there were only a few soldiers that have been quarantined. Then Iran COVID-19 claims 194 lives. Iran reports its largest coronavirus death toll within a 24-hour period. And 194 is pretty big to go up in one day. And it's alarming that in Iran, a lot of the public officials, members of their parliament, are being infected. And we had the second person who's die, who's a public official. Coronavirus isolates Iran more than sanctions ever did, but it keeps protesters off the streets. And here's a picture of a guy disinfecting a temple. Then we have a bunch of other areas that I just try to see if there's any significant news stories from, some of these other countries like France, Germany, Spain, Japan, United States. I spend some time on the United States. So if we take a look here, this is, Welt of the World. This is a German site. I just included this picture in here to show you that it's really hard getting news out of Germany. Even if you go to, the two big German site, the World and the Mirror, there's no stories in there about Germany. If you look at their coronavirus section, news here about Portugal, Italy, the one piece about a German guy on the lower left, German guy, 60, he died in Egypt, and that's the story on the upper right. German 60 dies of coronavirus in Egypt. And then the story out of France is more than 1,000 coronavirus cases. Death toll rises to 19. And this is out of France 24, but this is actually a picture and a story from Reuters. Then what do we have? We have Spain next, and news out of Spain, more than 500 cases confirmed in Spain as death toll reaches 10. So things are just escalating there. Japan's COVID-19 infections increased to 468. And of the 468, 14 of them, or among the confirmed cases, 454 were infected domestically, 14 were repatriated from other countries. So Japan is, has a lot of cases. Most of their cases, though, are, related to that cruise ship, because there were a lot of Japanese people on the cruise ship. It's a Japanese cruise ship, the Diamond Princess. Actually, it's owned by the Princess line, but it leaves from Japan, so it's a lot of Japanese people on the cruise ship. And also, if you take a look at this others number, 696, which I didn't highlight, that would be people from other countries who are in Japanese hospitals now. So if you want to take a look at the total number of people in Japan who have confirmed cases, it's that 696 plus the 461. But Japan, it looks like they have things under control now. Then what do we have? We have the USA. So the numbers today, 428 cases. I'm sorry, this is from yesterday. This is a slide from yesterday. So just remember these numbers: 428, 17 deaths, and 8 recovered. Then today we have 547. So cases are up from 428 to 527. Deaths are up from 17 to 21. And our hot pockets are in the Seattle area. We have 2 different counties there. That's why there's 2 different arrows. And San Francisco is also another hot area. Los Angeles and New York. And, this isn't really surprising that, the first cases in the United States were Chinese Americans visiting Wuhan for the Chinese New Year festival, which is huge. It's like Thanksgiving and Christmas combined, and it's just a big time in China. And it's not a surprise that these cities all have really big Asian populations: Seattle, San Francisco, LA, and New York. It's where most of the Asians in the country live. So it's not a surprise that some of them came home from Wuhan with coronavirus. Then this news here is a few days old, and I keep putting it up there because this is the problem in the United States. Washington State urges patience as COVID-19 test delays stoke anger. Why anger? Anger among medical people who can't get tests because we don't have any tests. Every other country in the world, this is 3 days ago, every other country in the world is conducting a huge number of tests. South Korea over 1,000 a day. over 100,000 in China a day. And the United States had only tested 1,000 people altogether because we have this incompetent bunch of people called the CDC. And that's where all the problem is in the United States. Doctor who treated first patient says COVID-19 has been circulating unchecked for weeks. Because why? Because we don't have any tests. We don't have any way of testing these people. You know, it's just crazy. Then we have some more news about cruise ships. Cruise ship passengers to be quarantined at military bases in 3 states. U.S. Army stops troops from moving to and from South Korea. We touched on that earlier. U.S. citizens should not travel by cruise ship, the State Department advises. So this is a new advisory that came out on Sunday. And this, this should almost kill the cruise line industry in the United States. And that's the way it should be, because cruise ships are just incubators for virus. And it doesn't help when you, it doesn't help when you have people on a cruise ship who were they were on a cruise ship that was infected, and they had to come back to port. This was the case in the one in California right now. So the cruise line, said, okay, you had a shortened cruise. We're going to give you, a new cruise. You can, gratis. You can go out on another cruise. 62 people on this ship were on the previous ship that came in. It only had a few cases of coronavirus. It wasn't like the one in Japan where there were, several hundred. But, those people went out again right away, and so did the crew. And that's just crazy because, nobody really has a good handle on the incubation period, and people that were, tested and deemed negative apparently weren't too negative because they went back out on a cruise ship and got everybody sick again. So it's just out of hand, cruise ships. Coronavirus live updates. U.S. Senator Ted Cruz to be self-quarantined after shaking hands with a guy who was positive at some, at CPAC. So I don't know whether this is news or political self-promotion. Then I watched some of 60 Minutes. It had a really big thing on U.S. hospitals, and this is some interesting stuff in the 60 Minutes thing. On the lower right, we have Johns Hopkins hosted a convention for a pandemic, a global pandemic of a virus, just a few weeks before the outbreak started in Wuhan. And the guy in the lower right is the Chinese head of the CDC, Center for Disease Control and Prevention in China. And, the same organization is in multiple countries across the world. So they hosted this and took a look at what could happen. You're going to have all kinds of things. You're going to have people traveling that come in that don't look like they have any symptoms, and then they go about, they spread the virus, throughout the population. So everything that they said in this, 10-minute span of this 60 Minutes came true. None of it was a surprise. So Johns Hopkins Hospital has a staff of 40 preparing for COVID-19, the pandemic, and also hosted an international meeting to discuss the pandemic. And, this lady here is the head of a team of 40 people getting ready. So this is, that it came out, Trump said a few weeks ago that the United States was deemed to be the country best suited to handle a pandemic. And that's true if you just look at the hospitals. The problem is, getting patients to the hospitals. The hospitals aren't the problem. So U.S. hospitals are well prepared, but hospitals are not the weak link. The CDC is a weak link. If you take a look at these people, this is in Johns Hopkins again, part of the 60 Minutes story. And if you take a look at these people, these nurses and doctors, they're in hazmat, virus uniforms that are outfits that are much more elaborate than anything else we've seen. They have their own self-contained breathing apparatus. So, it's not hospitals that are the weak link. There's a lot of these centers across the United States. I forget how many of them. They mentioned that in the 60 Minutes thing. There's, maybe 20 hospitals that were set up as, virus centers. And, Johns Hopkins is one of them. It's funded by some federal funding that was made after the SARS and MERS outbreaks and Ebola So they have some people that are outfitted pretty well, and other hospitals will follow suit. But like I said, hospitals are not the weak link. So this is a Johns Hopkins graph on the lower right side of the page, and you can click an icon to expand it. And I used to discuss it every day, but it's broken. It's been broken for a while now, a week at least. So we made our own graph, and this is off of Johns Hopkins data, and this is the United States only, U.S. confirmed COVID-19 cases, and it starts at 221, where I pulled numbers out of the Johns Hopkins data. I've been tracking this for that long. And it goes up through today, and you can see that it's just increasing wildly. There's out of control. We're going to have a separate video on CDC, the weak link of the American, pandemic. The cause of the pandemic in the United States is the CDC, the people that are supposed to be protecting us. So look for that video. I appreciate your time. That's all we have today.